I'm Puri. I work with the International Initiative for Impact Evaluation, or also called 3IE. For those of you who don't know what 3IE is, we're an international agency that provides technical and financial support in the form of grants to governments and agencies across the world for undertaking impact evaluations. We also provide quality assurance on impact evaluations that agencies want to undertake themselves. And we provide support in terms of facilitating training and other such activities. I'm going to be talking about cost, time, ethics, and numbers, confronting myths and building opportunities for impact evaluations with a specific focus on the UN system. Thank you very much for inviting me here for this session. I'm going to talk about three things: confronting urban legends, banishing myths, and what can the UN do? Let's talk about the first one. There are many, many questions that are often asked about impact evaluations and perceptions that we have about impact evaluations. The first one, and the most readily expressed one, is that they're really expensive. Second, they take very long. They're just unethical because they take resources away from, the thing that we do as part of development assistance and programming, and they put them into evaluations, or in many cases. So that's one part of the unethical argument. And the second one is, when you're trying to do impact evaluations, you have to, because of the nature of randomized controlled trials or other experimental methods, you have to deny people some part of your programming, and that's unethical. So that's one of the big issues with impact evaluations. The fourth one is that they are really quantitative, they are complex, they just do not encourage the use of participatory methods or of qualitative work. So let's think about let's think about these perceptions. And in order to deal with these perceptions, let me first start with what my understanding is of impact evaluations. Yes? One of the most important statements that evaluations can make, I call it the Holy Grail statement, is this: some program caused some change in some outcome for some population. Really, this statement is very simple. It basically says that, yes, there was some magnitude of change. So if you parse the statement, there are some very important things that the statement is saying. Yeah? It's saying, one, that there was an indicator of impact or of outcome that you're measuring, and you've identified it, and in this case, it's income. The second one, that there's a 7% increase. 7% or 20% or 50% or 1%, essentially it's saying that there's a magnitude that you've been able to measure. The third thing it's saying is that there is a direction of change. In this case, I'm saying it's an increase, but it could be a decrease, or you could very well say there's no change. But you want to be able to say credibly and with robustness that, yes, there's been a change. The fourth thing, and from my perspective, a really important thing that this statement is making, is that it's saying that there's a causal relationship between the program and what you're measuring, and the change in the outcome that you're measuring. That causality is really what is defining an impact evaluation. The ability to then connect the program, policy, or intervention with the change in outcome, output, or impact is really what we call impact evaluation. And thankfully, when I read the UN system's note, pretty good note actually, on impact evaluations of 2012, it says exactly this as well. So to make this statement, the first thing that you do have to do is to try and see, in an ideal case, but in an impossible case, to be able to measure, you want to be able to measure on the same population the effect of the program and the effect on the people without the program. Of course, this is impossible because you can't look at the same population and see what would have happened to them with or without the program. And so in usual cases, what you can see is you can either see what would have happened after the program, also called the treatment, or you can see what would have happened without the program on a different population. But because you can't see this on the same population, you use what are called comparison groups. Yes? So this is essentially the format of most impact evaluations. You have a project or an intervention group or a treatment group or a group that has been subjected to a policy. And you want to find a comparison group that looks very much the same. And in this case, it's very easy for me to do that because I just put the same picture. And you want to be able to measure their condition before the program, but you also want to be able to measure their condition after the program. And then you use what's called a difference in difference. Now, this is really the underlying sort of formula for what you're doing when you're doing an impact evaluation. Of course, it's much more complex than this, but essentially what you're saying is, let's have baseline for both a comparison group and a treatment group, and let's have end line for a comparison group and the treatment group, and you difference the two, the end line minus baseline for one, end line minus baseline for the other, and you take the difference of the difference. So that's why it's a double difference. Of course, you can't just take one data point in one group, in the project or the intervention group, and one in the comparison group, and then compare them, because then there's the problem of bias. So you need more than one observation required per group to avoid bias, statistical bias. And this is the other sort of problem, so to speak, about impact evaluations, is that, of course, you need a lot of data points. You can't just go with one comparison group or one observation and compare it with another one. Okay, so what does, using this formula, the main way in which we think about impact evaluations, and as has been touted in many, many groups, is that you can do a randomized control trial. Now, let's be sure, a randomized control trial is not the only way in which you can do an impact evaluation. There are quasi-experimental methods, there are a whole host of other methods that set up counterfactuals. The important part of an impact evaluation is that you should be able to set up a comparison group or a control group, whether that's implicit or explicit. An explicit comparison group essentially says that from the beginning of the program, you're identifying what your comparison group is and you're going forward. An implicit comparison group is one that is used in quasi-experimental methods where you're trying to artificially construct a comparison group. You did not construct it at the beginning of the program, so you go to the end of the program and you look at all of the data that you've collected and try and construct it using matching methods in an artificial way, using propensity score matching, et cetera, et cetera. We're not going to talk about that now. But really, the main way in which you're thinking about impact evaluations is that you either have an implicit or an explicit counterfactual. How this is undertaken in, for example, a randomized control trial is this. And I'm only going to use this diagram to illustrate what happens in an impact evaluation, but then to underscore how bias gets dealt with. Okay, so when you're setting up a randomized control trial, for example, you have an eligible population. There are dark and light spaces there, which essentially say that there are different people that are stratified in different groups that you want to be able to measure the impact on, for example, or the effect on. From your eligible units, you then select an evaluation sample. This is the first important point. An evaluation sample is not your entire population. In most cases, it's a subsample of your entire population that is eligible for the program. So for example, if you have a country-wide program, that you're implementing, you don't have to think about you're collecting data for the entire country, whether a comparison group or a treatment group. You select a small group and you think about doing your evaluation over that subsample. That's first. This evaluation sample has the same distribution as your eligible population. What that means is that it shows the same kind of strata that you want to be able to measure impact on. Because this establishes external validity. It essentially says that you are taking the results from your evaluation sample, and if you have those results and they're credible and they're robust, you will be able to apply that to your entire eligible population. Okay. Now, on this evaluation sample, you're essentially saying, in a randomized control trial only, you're saying, let me think about random assignment. And in most cases, this is done very easily. You can flip a coin, you can roll a die, you can run a random number generator on Excel, whatever you want. But essentially, let's throw a die, and you divide it into a control or a comparison group, also called a counterfactual, where you don't have a treatment, and the other group where you do. This is how it's classically sort of set up. But in real life, you actually have many more variations on this than not. Okay. But this part is important because it helps you deal with bias. It helps you deal with selection bias and a whole lot of other biases, because here you're randomizing. You're randomizing for your evaluation sample so that they lie either in your treatment group or in your comparison group. And this is what is helping you establish internal validity. Essentially, you're saying that if I can establish that, yes, a program caused an effect using this, I have an internally valid result for this evaluation sample, and that can be then imputed or applied to your entire eligible population. That's really sort of mostly the setup. Okay, the question of bias here is very, very important. And let me try and illustrate that with something that was done after the Pakistan earthquake in 2005. In 2005, there was, as you all know, a huge earthquake in Pakistan, and the Earthquake Reconstruction and Rehabilitation Authority was set up. The primary responsibility of the Earthquake Reconstruction and Rehabilitation Authority was really to allocate reconstruction funds, yes? And ERA undertook a social impact assessment. What it did was it conducted a pre-post analysis of looking at people who had been affected by the earthquake in the earthquake-affected areas. So they actually went to the Northwest Frontier Province as well as Azad Kashmir. These were the two most affected provinces. They selected 9 districts from them, and from 1,350 villages, from 30 villages, they collected data on 1,350 households. This was, unfortunately, done 3 years. So the baseline was constructed in 2008, the first baseline, and they used recall data. And then the end line, or the attempt to capture the effect of the reconstruction facility or the fund, was undertaken in 2009, which was 4 years after the earthquake. Okay. Now, what was important in this effort was that they first looked at the population that was already there, that they had distributed reconstruction funds to, and that they used recall data for the population to construct a baseline. Let's think about the types of bias that can enter using this kind of a method. Yeah? The first one is selection bias. Remember that they went in 2008, and they looked at households, 1,350 households in over 9 districts, to ask them, about their conditions before the earthquakes and after the earthquake. Forget the recall bias question. The important part was that they were looking at households that were there and that had received the reconstruction funds. There are two kinds of biases here that can enter. The first one is that they weren't counting households that had moved away as a consequence of the reconstruction funds that had been provided. Yeah, so it had enabled and made them less vulnerable, those households that managed to move away. In this sense, then, they were understating the effect of the reconstruction funds because it had actually reduced their vulnerability. But they also were not counting households that had perished as a consequence of the earthquake for whom help did not arrive in time, unfortunately. In which case, then, the bias really overstated the impact that they had made. And this is the case in most data collection efforts, that not only is there bias, but you also don't know which direction the bias is going in. Because if you knew, for example, that in most cases I'm understating the effect or overstating the effect, you could correct for it. But in most cases, you don't know. The sources of bias and the directions in which it influences your measurement are in both directions. Okay, so the second thing is information bias. And this is really what happens in almost all surveys, that people respond according to what they think their incentives are, as well as the incentives of the surveyor. So in this case, if they thought that, yes, understating their condition could show that they were very productive, they could understate their condition or overstate it. That's pretty normal. But the third one is contamination bias. This pre-post assessment did not really consider the effect of social networks or remittances that had come from outside to also alleviate some of the suffering that earthquake-affected people were experiencing. So what are the lessons here? See what bias can do for your results, and this is really where the use of counterfactuals makes a big difference. Use other data sets where these are available. In this case, the first effort actually ignored the presence of the Pakistan Living Standard Measurement Survey, and this has been seen in numerous cases across the world, that existing data sets are ignored, much to the peril of the evaluation, actually. In a subsequent effort, when they tried to correct for some of these biases, they did use some of the same questions that had been used in the Pakistan Living Standard Measurement Survey, and then increase their sample size as well. And the third one is don't oversample. You don't have to go and look at actually even 1,350 households for the kind of effects that you're looking for. So, going on then. The second example that I really want to present is that of a ready-to-use supplementary food effort that was distributed in Chad, in northern Chad. And this, for me, brings out some of the hopefully, to try and dispel some of the other problems that we have with impact evaluation. So just to set it up very, very quickly, the question here was to assess the effectiveness of ready-to-use supplementary food, which is, as a lot of you may know, is a mix of peanuts and a whole lot of other good stuff, to reduce wasting in children 3 to 36 months. And the main outcomes that they were examining was hemoglobin and the incidence of anemia. They were looking at 45 neighborhoods in Abeche in northern Chad. And the findings were that there was no effect on the incidence of wasting. There was marginal or positive effect on the length of kids or the height of kids. And there was positive effect on hemoglobin and on diarrhea incidence, but this was insignificant. But really the main message here is that the impact evaluation used participatory methods to even identify the 7 most vulnerable neighborhoods that were chosen for this evaluation. To even select the most vulnerable households, they again used participatory methods to identify them. And they then divided them into 14 clusters from these 7 neighborhoods. And in these 14 clusters, 7 of them got food assistance, which was really, what you call the standard of care in medical parlance, or really stated par for the course. So 7 got food assistance, and the other 7 hoods got food assistance and ready-to-use supplementary food. And then they compared the effect on wasting and height for age in the 7 that got ready-to-use supplementary food and food packages regularly, compared those with the incidence of anemia and hemoglobin in the ones that did not get RUSF but still got the food packages. Okay, so the takeaways in this were that from the start of the program to the end, i.e. when the analysis was presented, the whole evaluation took 18 months. But remember that they were doing it, one, in a deeply humanitarian crisis context. Second, they had never done this before, so they had to start thinking right from the beginning as to how to even plan the survey, etc. But essentially, it took them a year and a half to do the entire thing. Second, there was no one who was denied any assistance, because food packages were distributed to everyone in all of the neighborhoods that were targeted. And the third thing is that this was a multi-agency humanitarian crisis, a very, very complex situation, and they were still able to undertake an impact evaluation here. And this was actually undertaken by ACF, or Agence Contrôle des Femmes. Okay, so thinking about this then, let's try and address some of the myths that I put up earlier on. The first one is, what about the ethics of impact evaluations, and what can we say about denying people interventions or programming assistance? In oportunidades, which is really, or progresa, as a lot of you might know it, which is really the poster child of impact evaluations and is used over and over again to give an example of how impact evaluations might help to change policy. But it really was very effective, because this was a program that started off as a $2 million program in 1995 in Mexico, and went on, because of the impact evaluation that showed that there was a 10% increase in enrollment amongst girls and 8% increase in enrollment amongst boys, as well as a reduction in mortality amongst 2-year-olds. This program, the impact evaluation was very successful, and it went on to getting scaled up nationally and went on to become a $5 billion program by 2002, and now, of course, is a national program and called Oportunidades. But the important point here is that there were 525 villages that were first targeted for the impact evaluation. Of these, 230 got the conditional cash transfer, and the others did not. And that's not because the government didn't want to give it to the other villages. It's because they just didn't have the wherewithal to distribute the entire conditional cash transfer package to all of the villages. And this is the reality for most development assistance programs. You cannot be universal from day one. So it used what's called a stepwise or a phase-in or a rolled-out evaluation design. So in year 1, the conditional cash transfer program was provided to 230 villages, and then in year 2, the other villages got the program. No one was denied the program, but because it was a rolled out impact evaluation design, you were able to measure those that got the program in the first year with those that didn't, who eventually ended up getting it. The second is the RUSF example that I just gave for Northern Chad, where, again, the factorial design, or really the design which gave ready-to-use supplementary food to 7 neighborhoods and ready-to-use supplementary food to 7 neighborhoods along with the food assistance package, allows us to see as to how this may be done without denying anyone any intervention. And the third example here is that of a community-driven development, which is, here the example is one of Sierra Leone, where community-driven development programs were implemented for 118 villages, and they used what's called a pairwise matching design. And again, this was done not because the government didn't want to give these block grants as part of community development programs to all 236 villages that they actually wanted to target, but just because they didn't have the resources. So they just did the Go Before program, or the community development program, in 118 villages at the beginning, and then went on to see actually that the community development program didn't have much of an effect on social cohesion, but did have it on infrastructure, but that's a different story. So the first one, are there questions about ethics, about denying people programming assistance? And I'd like to say no, not really. Second one, takes very long. That's, again, a very, very, I think in many cases it's a good and a right objection, but so do a whole lot of other studies. I know many, many non-impact evaluations that take many, many years. Okay, so taking very long really depends on the intervention, and I can't stress this enough. If you're thinking about, if you have a good theory of change, and if your linkages are pretty well developed for looking at outcomes at the end, you don't have to take very long. I'm going to give you a couple of examples here. This is one of medical male circumcision. We know that in the theory of change, if adult men are circumcised, this is the efficacy of that linkage. If adult men are circumcised, then the incidence of HIV/AIDS reduces. That efficacy is pretty well established. But what is really, really key in this theory of change is not the efficacy of that linkage, but really looking at the uptake of male circumcision, of voluntary male circumcision amongst adult males. And we are looking at this program in Africa, for example, in 6 countries, and looking at the uptake of male circumcision amongst this population is a very, very quick process. You can see uptake in 6 months. So you can then undertake this impact evaluations very quickly. The second one is the RUSF example that I just gave, which took 18 months. And the third one is malaria. For the Clinton Health Access Initiative, they wanted to understand the impact of malaria bed nets. They didn't have to wait to measure the hemoglobin levels or the parasite levels in blood and to take blood tests. What they needed to do was just look at the uptake of treated bed nets amongst households. Because they know that if your people are rightly using bed nets, then you can conclude that the incidence of malaria will reduce. So what's the conclusion here is that for ex-post evaluations, which I can talk about later and offline, mostly you can take about 12 to 18 months to undertake ex-post evaluations. For ex-ante designs, we're thinking about 3 to 6 months for survey design. We are also thinking about report writing and analysis in 3 to 6 months. But really, the middle part, which decides the length of the impact evaluation, is dependent on the outcomes or the outputs or the impacts that you want to measure and the strength of your theory of change. Okay, and then very quickly, I think my third last slide, Mike. Is that okay? Okay. Some other questions that arise a lot of times is, what is the impact of impact evaluations? Do they really bring about a change in policy? My favorite example, my current reigning favorite example, is that of pollution in Gujarat in India, where we supported a study that looked at 210 factories that used third-party auditors versus those that used auditors that have been paid by the factories themselves, and found that there was a huge reduction in air and water pollution emissions by the factories that use third-party auditors. And this is now spread widely all across India, and a lot of other states also using it. The second question is, do impact evaluations really help us to assess whether the program works? In the case of GOBI, for community-driven development programs, which we also see in Liberia, Afghanistan, Somalia, Chad, impact evaluations have shown that community-driven development programs actually don't work very well to increase social cohesion, which is really the primary outcome that they're mostly looking at. But they help to increase the level of publicly provided infrastructure. So if that's the outcome that you're looking for, definitely undertake community-driven development programs. But in terms of social cohesion, social trust, they're not very effective. They also help to examine unintended results. This is the example in West Bengal, where we found that, yes, pricing groundwater, although it's advocated for by environmental economics, had the unintended result that a lot of small farmers were adversely affected and their agricultural productivity reduced. And so it made the government of West Bengal take away a lot of the other tariffs that were much more unproductive and inefficient. They also help to assess how much is good. In the case of malaria bed nets, we all know, yes, malaria bed nets and the correct use of malaria bed nets can help to reduce the incidence of malaria. But what is often not recognized is that you require in a village at least 50% coverage. That is, 50% of the households in a village should be using malaria bed nets correctly for you to bring about a 20% reduction in malaria incidence. So if you're just distributing malaria bed nets and you only see a 25% uptake of malaria bed nets, you're not going to find even a 10% reduction in malaria incidence in those villages. And they also have to inform as to how we should do them. This is an example of Indonesia, where usually targeting was undertaken with the help of self-targeting mechanisms. So people had to come forward for a lot of the public programs, and they had to say, well, we are poor, help us out. But an impact evaluation that compared three methods. One is proxy means test, which is really looking at the assets that households have. The second is community-based targeting. So communities were asked to rank households on the basis of what they perceived their poverty condition was. And the third was self-targeting. Found that proxy means tests can be efficient, but community-based targeting are efficient and increase satisfaction hugely. People are much happier when community-based targeting methods are undertaken, and their welfare increases, their indicators of happiness increase. The government of Indonesia has now instituted a combination of self-targeting and community-based targeting to now help to target for their public delivery programs. Okay. The last slide, and I will stop after this, and just hopefully address some of the other questions offline or during discussion, is that impact evaluations can only be done using RCTs. I can't say this over and over again. I can't oversay it, really. This is actually work that I've done in Guatemala, which is to really look at the impact of roads on poverty. The World Bank was doing an $80 million program, which was the second part of a loan that they were giving out to Guatemala, and they wanted to know what the impact on poverty was. And this was, the program loan was really conditional on this, on understanding poverty indicators. The big problem here was that you find that roads are located in areas that are also rich. Yeah? So you don't know which one comes first. Are rich people or rich provinces much more successful in getting roads, and that's why they get roads? Or do roads make people rich? So that's the indigeneity problem. But using then the disaggregated poverty data sets as well as their living standard measurement survey, I essentially did an ex post quasi-experimental impact evaluation of this question and found that, yes, there are effects, actually. Impact evaluations use only quantitative methods? No, it actually takes a village to do an impact evaluation successfully. You need everyone who has skills such as qualitative skills, anthropology skills, participatory skills, statisticians, etc., to come together to do a good impact evaluation. And context is really, really key. They are costly. Yes, in most cases, you can, if your theory of change indicates that you don't know what the efficacy of your last link is, and if you have an impact evaluation going over 5 years, they're going to be costly. But if you know that, yes, all your other linkages are pretty well established, then you can do impact evaluations quickly and cheaply. Just a quick idea of what the numbers look like. The IDB, Vocational Training Study, had impact evaluation for $20,000. Clinton Foundation study on malaria bed nets, $50,000. But then the independent evaluation group from the World Bank looked at rural electrification, and that was for $120,000. But most impact evaluations, especially if you're looking at 3 years or more, take about $300,000. But you, yeah. I need you to survey a lot. Actually, in the latest impact evaluation design that I was just thinking of, looking at a multi-agency context where we're looking at the effect on anemia and you only need to survey 50 children in each group. So one group that got RUSF, one group that just got the food package, and one group that got food package and RUSF. Only 50 children per group. That's all you needed to survey. So I'm going to stop here, Mike. I do have more slides, but I'm really conscious of time, and perhaps I can try and address them during the discussion period. Thank you so much.